The Sudanese army and a rival paramilitary force that have been battling for the past 4 days for control of the country have agreed to a 24-hour ceasefire. This came after U.S. top diplomat Antony Blinken urged warring factions to ensure the safety of civilians. The violence, which erupted on Saturday, raged for a fourth day, with the death toll increasing to at least 200 people and another 1,800 injured.
Explosions rocked the Sudanese capital Khartoum as fighting that has claimed nearly 200 lives entered the fourth day despite growing international calls for an end to hostilities. The Sudanese army and the rapid support forces have agreed to a 24-hour ceasefire starting 6 p.m. Tuesday. Mohamed Hamadan Dagalo, the head of the rapid support forces, said they agreed to a ceasefire to ensure safety of civilians. Earlier in the day, United States Secretary of State Antony Blinken said he had spoken to leaders of rival armed forces in Sudan and urged an immediate ceasefire. The United Nations says 200 people have been killed since the fighting began on Saturday. More than 1,000 people have been injured. Many hospitals in Khartoum remain out of service, and medical personnel have been unable to reach healthcare facilities.
We are calling, of course, on both sides to allow access for aid workers, humanitarian aid workers, and to allow evacuations. We also we strongly request both sides to respect the need to protect UN agencies.
Millions of Sudanese in the capital and in other major cities have been hiding in their homes, caught in the crossfire as the two forces pounded residential areas with artillery and airstrikes and engaged in gun battles in the streets.
The last few days have been pretty much all of us just staying indoors, and trying to keep our sanity intact. Bombardments usually start around 4 a.m. and they continue on for a few hours, but today they haven't stopped.
Residents in the embattled city are hoping that the ceasefire will ease human suffering.
We'll take a short break on NTV tonight, but after this, Nina Shaban has the latest.